pleased to address you once again, fellow Lagosians, and in line with our commitment to continually update you on the progress of our collective fight against the COVID-19 pandemic. The third wave is already here with us. As much as we would have wished for a more positive outcome, we do not have a choice than to tackle it and to tackle it head on. As I noted in my last address, which was on the 10th of July 2021, from the beginning of July, we had started to experience an increase in the number of daily confirmed cases of COVID-19 in Lagos State. It had become necessary for us to deploy our telemedicine, which we used in managing our positive patients. And in the same vein, we have launched an home care-based program, which is driven by our Eco Telemeds call center. This home care-based program had worked in delivering our care packs to our asymptomatic patients. And if you have any symptoms, like we'll continue to say, that is associated with COVID-19, or that you think you have tested positive to the virus, we'll continue to encourage you to take advantage by reaching us on our Eco Telemeds, which is a toll-free number, which is 08000 356 633, which is 08000 356 633, which we also call the 08000 EcoMed. I think it's important for us to mention where we are regarding the vaccine distribution and access strategy for vaccines. We would say that about 1% of our population have received the double dose of the AstraZeneca vaccines. This is quite low, especially considering that we now have confirmed cases of the third wave, and we're exploring all avenues to possibly ramp up access to vaccination so as to reach what we see as a global herd immunity of about 60% of the population. Experience from other regions of the world show that majority of the confirmed cases that have resulted in death were unvaccinated persons, meaning that what we've seen in other parts of the world, it's people that have not been vaccinated at all that leads to fatality. I think it's gratifying to note that yesterday, 1st of August, Nigeria received 4 million doses of the Moderna vaccine. And I think it's been widely reported. We received 4 million doses yesterday. We're being told that the samples are currently being tested by NAFDAC. And we're expecting that Lagos being the epicenter, that will receive a sizable amount of this allocation once the testing, and I believe will be completed before the end of this week once it's been completed. These vaccines cannot be mixed with the AstraZeneca vaccines. Let me repeat, for people that have taken the first dose of the AstraZeneca, they cannot mix it with the Moderna that has just been received now. But we're still expecting a second allocation of the AstraZeneca vaccine, and we've been assured that they should come before the end of this month. So we're monitoring that as well. So meaning that people that got the first vaccine, that are AstraZeneca, they should just wait for us to get the new set of AstraZeneca, right? And they'll be able to get their second dose. And so the doses of Moderna will be people that will be taking, the very first doses of the Moderna vaccine. As directed by the Presidential Steering Committee, passengers that are coming from the red zone countries, there are countries that have been designated as red zones, which are India, South Africa, Brazil, and Turkey. They are required to observe what we call the mandatory isolation. So meaning that anybody traveling into the country from this, they are meant to have a mandatory 7-day isolation. So far, we've been able to successfully isolate over 5,178 passengers that have arrived into Lagos. I think it's also very important for us to mention at this junction that only state-accredited medical facilities can manage COVID-19 cases. It's important for us to also still mention our non-pharmaceutical interventions and protocols. I would like to implore all our primary, secondary, and tertiary educational institutions to cooperate with officials from the Ministry of Health and Ministry of Education to ensure that the safety of our people are taken very seriously. If you notice anything in any of your schools, please let's cooperate and work with the Ministry of Health and Ministry of Education, and let's see how we can help you, and we can send test officers into your various schools, and we can manage. People should not hide. If they notice or if they suspect anything happening in their various schools, please, they should speak up and they should speak out so that we can manage this third wave, very quickly and very decisively. We want to also re-emphasize that all our existing rules and guidelines around social and public gatherings are still in place and must be obeyed. I want to encourage all residents of Lagos to keep themselves familiar and updated with the restrictions guidelines as outlined by the states and federal authorities. In addition, the non-pharmaceutical interventions of mandatory face mask and physical distancing in public places, regular hand washing, and avoidance of non-essential movements must continue to be taken very, very seriously. Most importantly, and particularly, I would reiterate the need for everyone to wear their face mask. All establishments, offices, entertainment spots, commercial spaces, and religious houses are mandated to provide hand washing or sanitizing facilities and to ensure that persons are admitted only with their face mask. If you don't have face mask, want to reiterate that you have the right to deny people access into your facility if they don't comply with the rules that have been set. Proprietors of public transportation services must also refrain from admitting non-compliant passengers into their vehicles. It is only by strictly adhering to these rules that we can indeed stand a chance at taming this third wave that we have with us now. We're no longer inexperienced as a people in dealing with the coronavirus pandemic. 18 months into the pandemic, we have learned a lot as a people, as a government, as a state. We have seen the progress and we've also noticed the setbacks. We have been able to refine our strategies and our response. And we're now in a good place to ensure that this third wave is the final one. I believe we can close the pandemic chapter very, very soon. But we all need all of us to work together on this. But we must put in the work, we must ensure the high level of compliance, and we must ensure that the rules and regulations are strictly adhered to going forward.